Prospective partners, we wholeheartedly support the LGBT community, and we have tons of options for helping patients from that community conceive. So treatment options can be anything from using donor sperm to using donor eggs, using a surrogate, and any combination of those things. For same-sex couples that are women, oftentimes they will opt to use a sperm donor, and that can be done in a couple of different ways. If they know somebody that they would like to use as their sperm donor, we can help them navigate that process. If they want to use an anonymous sperm donor, we certainly have tons of referrals that we can give them for finding a good sperm bank and finding a donor that they're interested in. For same-sex male couples, oftentimes they will use an egg donor and a surrogate, so we can certainly point them in the right direction for finding an egg donor, and we can help them find a surrogate to use to conceive that pregnancy. Also, couples sometimes will do reciprocal IVF, and what that means is that in a, for instance, in a same-sex female couple, one of the partners may donate the eggs and the other one carries the pregnancy. So there are so many different options. It can be as simple as using donor sperm for insemination, and as complicated but easy still as reciprocal IVF. One of the options for females is to use a sperm donor and do a intrauterine insemination, or IUI, using donor sperm. What that means is that we would track a woman up until ovulation, and when she is ovulating, we would do an intrauterine insemination where we take donor sperm and then insert it into the uterus. We use a small little catheter that looks like this. It's small and flexible. It's not usually uncomfortable or painful at all. It just gets slipped into the uterus. It almost feels like a woman is getting a pap smear. The procedure takes just a couple of minutes, and then 2 weeks later, she finds out if she conceived or not. Another option for female couples is to do IVF, and that's in vitro fertilization. So what women what they would do for IVF is they take hormonal medications to stimulate egg production. Then we retrieve those eggs from the ovaries, and so your eggs are now outside the body, combine them with donor sperm outside the body, make our embryos, and at that point the couple can have the option of doing genetic testing on those embryos prior to implanting them. And then basically we get the woman's uterus ready for implantation, and it's a very similar process. We put an embryo into a small little catheter like that and then insert it into the uterus. Some couples will opt to use one of the partner's eggs. So she would undergo IVF, and then we take those eggs, combine them with sperm outside the body, and then we transfer the embryo back into the other partner's uterus. So then it would be the other partner's uterus that is prepared for implantation. And then for male couples, we have also lots of options that we can provide. We can use donor eggs, fertilize those donor eggs with sperm from one of the male partners, and then transfer the embryo into a surrogate. It is an option also for male couples to have their surrogate sometimes carry a twin pregnancy. And what can happen in that situation is we can get donor eggs and fertilize them with the sperm from sperm from each of the male partners, and then transfer an embryo made from each partner's sperm into the surrogate's uterus. It can result in a twin pregnancy with one pregnancy from each of the partners.